Somnophobia is an unrelenting fear of falling or staying asleep, leading to anxiety-induced insomnia. Keep watching to learn more about the causes, symptoms, risk factors, and how to manage symptoms. You lay down after an exhausting day at work, hoping to drift off to sleep. However, you know that this will not be the case. Upon closing your eyes, the same irrational fears surrounding the darkness of sleep swirl in your mind. Thoughts of death, being trapped within a liminal void, and the loss of consciousness get your heart racing and you start to sweat, making it impossible to sleep. What is somnophobia? Somnophobia is the unrealistic fear of falling and staying asleep. Anxiety can be triggered by just the thought of falling asleep, which is why many with the disorder delay going to bed. Like any phobia, it's typical for those with the disorder to try and hide their symptoms. What causes somnophobia? Somnophobia cannot be narrowed down to a specific cause. However, its occurrence is heightened by PTSD, genetics, other sleep disorders like night terrors, or a fear of dying. What are the symptoms of somnophobia? Symptoms are similar to those found with a general anxiety disorder, including chest pain, nausea, shortness of breath, heart palpitations, chills, and sweating. Once you start to experience symptoms, you'll tend to avoid going to bed and leave the light on when you do. What are the risk factors? Somnophobia is a considerably new sleep disorder. However, to date, these are the identified risk factors: female gender, advanced age, depression or anxiety, stress, shift work, travel, and genetics. What are the co-occurring disorders? Somnophobia can indicate presence of psychiatric disorders like mood, anxiety, or substance abuse disorders. It also occurs along with thanatophobia, which is the fear of dying, which can be triggered by the loss of a loved one in their sleep. Sleep disorders like sleepwalking, nightmare sleep disorder, or sleep paralysis can also lead to somnophobia, as a few bad experiences can lay the groundwork for fear of sleeping. Keep watching because we're about to touch on diagnosis and treatment options. How is somnophobia diagnosed? Somnophobia can cause significant disruption to daily life, including daytime fatigue, problems concentrating, and irritability. Underlying sleep disorders or conditions must be diagnosed to determine effective treatment. A somnophobia diagnosis may be made if you experience sleep-related distress, avoid sleeping, or you've experienced symptoms for more than 6 months. How is somnophobia treated? As with other anxiety-related disorders, somnophobia can be treated with cognitive behavioral therapy, exposure therapy, dialectical behavior therapy, mindfulness-based stress reduction, yoga, or meditation. What about medication? Medication can also be used in treating symptoms of somnophobia, depending on severity and coexisting disorders. Each treatment is unique, and people respond differently to each treatment modality. If you are experiencing symptoms, it's best to speak with your doctor. Help is available.